Well, good afternoon, everyone, and welcome to the latest edition of the Detroit Regional Chamber's Telephone Town Hall. We are so glad that you've taken time out of your very busy day to join us. Joining me today in the questioning of our special guest is my colleague, Matt Patton, who will do the Q&A at the end of our session. But our special guest today is Dr. Joneigh Khaldun, the state's chief medical officer and the key player in Michigan's fight against the coronavirus. Dr. Khaldun, thank you so much for taking your incredibly busy and valuable time to share your insights and where we are in Michigan in the fight against COVID. Thanks so much.
Oh, thank you for having me here. I'm happy to join.
Right. Well, Dr. Khaldun, I have a whole bunch of questions regarding where Michigan is in the fight against COVID-19. I want to talk about contact tracing, but I want to give you a few minutes kind of at the beginning of this to kind of give us your perspective of where we are and how the state is doing.
Absolutely. So I know it's been a long 2020 for everyone. I can tell you in the Michigan Department of Health and Human Services, we've been fighting COVID-19 really since the beginning of January. Our team of epidemiologists and career public health experts have been paying attention to this since the first cases were coming out of Wuhan. We were preparing our local health departments, our healthcare systems, and really it became clear in late January that it was only a matter of when and not if COVID-19 would be coming to the state of Michigan. As you all know, we had a rough time, especially in March and in April, and particularly in the southeast area of the state, where we were seeing about at our peak about 150 deaths per day, thousands, more than 1,500 cases per day. Our hospitals were overwhelmed. We also quickly had to ramp up testing. Unfortunately, I don't think there's any question that the United States was behind in getting testing up and going. We rapidly started up testing first with just a couple hundred tests in our state public health laboratory, but our laboratory experts at the state were also able to quickly bring online additional labs, both in state and out of the state. And we're now doing almost 30,000 tests per day here in the state of Michigan, which is a major feat. But we brought our curve down. I say we collectively as Michiganders, people staying home, staying safe when they had to. I know our healthcare systems, our frontline workers, our business owners also have just sacrificed a lot when it comes to COVID-19, but there's no question it has saved lives. We're not out of the woods yet, though. The governor has been able to relax the stay home, stay safe order that she'd issued in March, and now we've been slowly reopening the economy. Unfortunately, we're still seeing new outbreaks. We've had to walk back some of the things that we've already reopened. But I'm hopeful. I'm hopeful that we can keep the spread of the disease down as much as possible and that we can continue to save lives. Until we get a widespread vaccine that's effective, we're going to be in this stance for some time. So it's important that we all remain patient, that we all do the simple things like wearing masks, staying home if sick. Of course, the contact tracing we'll get into a little bit more, but answering your phone if a public health staff person calls you, social distancing, those are going to be the bread and butter public health things that we'll all have to continue to do to stay safe.
Well, first of all, before I get into the questions and dive a little bit more deeply into some of those issues that you touched on, a big thank you to you and your team. I mean, it's now been 6 months plus that you all have been pedal to the metal, really trying to keep Michiganders safe. So thank you for that incredible public service. It just really is greatly appreciated. So let's dive into some of those numbers that you just mentioned. So our 3-day average of new cases peaked back in early April at roughly the 1,700 level. We went down to a low back in early June, and now I think we're roughly in the 600 per day range. Put that into context for us, Dr. Khaldun. I mean, is that a good place to be at about 600 plus cases per day? Is that worse than you expected, better than you expected? Help Michiganders understand where we are right now.
Right. So there's no playbook, as you all know. For most other infectious diseases, there's a handbook I can go to, and someone's done this before. But it's like you all know, it's a new virus, and we're all learning how to respond to it. It's important when we look at all of the indicators that kind of determine where we are when it comes to responding to this outbreak. We look at cases, we look at also deaths, of course, but we also look at the pattern. So is it a 2-week or 3-week increase or decrease? An important thing as well is to look at testing capacity. As you all know, early in our response, we didn't have enough tests, and we were really only testing people who were the sickest. Even in the very, very beginning, when the CDC was the only lab performing the tests, you had to have a history of international travel even for the most part to get tested. So now we've significantly expanded our testing capacity. And so we're responding to outbreaks more quickly. We're getting test results. We're doing the contact tracing and isolation. We certainly look at things like, again, the case rates, the percent of tests done that are positive, which is really, really important. If you're testing broadly, which we are, you're increasing your testing, but your percent of tests that are coming back positive remains low, and we like it to be below 3%, that's when you know you're in a good place. When that percent of testing done starts rising, as it is slowly here in Michigan, it's about 3.7% over the past week, that's when you want to be concerned that there is still community spread going on. And so those are some of the things that we look at.
So I want to press on that 3% number a little bit. So at yesterday's press conference, you announced the total number of COVID cases at a little over 79,000, a little over 6,000 Michiganders have lost their lives. But you said other things, and I want to make sure we put these numbers in context. You talked about the number of cases, which you say are plateauing, and then you talked about hospitalization rates, which are also plateauing. Death rates are falling. Can you put into context the number of cases versus hospitalization rates versus death rates versus positivity rates, and what do each one of those numbers tell us, and why are they different metrics to look at?
Sure. I mean, just like any disease, and I'm an ER doctor as well, just like any disease, you don't just look at one lab result necessarily to tell you what's going on. You look at the lab result, you look at the history of the patient, you do a physical exam, you talk to the patient. So it's really all in context. And I know that also makes it very difficult for people to grapple with, because there's not one magic number that will tell us we're good or bad, or we should open something or not. It really is the context. So it's changing again. Early on in the disease outbreak, when we weren't testing very many people, our death rate obviously was higher because we were only testing, we only knew of the sickest patients who had a high likelihood of being very sick and therefore dying in the beginning. So now our deaths have been stable, right around 4 or 5 per day over the last several weeks. And we have not, thank goodness, seen that tick up as we've seen the cases tick up since the beginning of June. So that's a good sign. We obviously also watch the deaths, but it's also important to know deaths are going to lag a little bit behind the case identification. Imagine, someone gets sick, even if they go into the hospital, they have to get that test done, and that test is resulted, and then they fight it. And hopefully they win their battle, but unfortunately some don't, and that's when we see those deaths again. We also, when it comes to the deaths, we also have a process where our local health departments are interviewing every positive case for their family member, if that particular person who still cannot speak. But then we also go back and look at our death certificates to match up where someone may have had COVID-19 listed as a contributor to the death.
Gotcha. On the 3% number, you've been very consistent and really focusing on the 3% positivity rate. And so why is that being over or below the 3% positivity rate in testing? Why is that an important number for people to know? Oh, did we lose Dr. Calhoun's sound? Matt, can you hear Dr. Calhoun?
I cannot. No, it looks like the signal might be a little.
So 3% is a number where, again, that's currently. Can you hear me?
Yeah, we got you back. I think it was just a little internet glitch.
Yeah.
Back to
okay,
3%.
I'll start again. All right. Yes. So 3% is, again, it's an estimate. Again, there's no handbook. There have been no prospective trials on COVID-19 over the past 10 years like we have with other diseases. But 3% is something that national experts have said when you have sufficient testing, and that's really important. When you have sufficient testing such that your denominator of all people who've been tested is pretty high, and you can look at what percent of those people are coming back testing positive, if that's going up, meaning you're testing enough people in the community, but they actually do have the disease, that's when you want to be concerned about it. There's other cutoffs. There's actually other states that are looking at 8%, 10%. Again, all of these things we look at as far as trends. Obviously, I'd love for it to be 1%, 2%. But when you start getting over 3%, that's when you want to be concerned. And certainly, like other states across the country, Texas, Arizona, where you're looking at 10, 20%, especially when you've got good testing, you really, really want to be concerned about community spread and outbreaks in your state.
Now, speaking of testing, I think we're at roughly, what, 80,000 tests per week now? Is that where we need to be? Do we need to do even more testing? What's the status of testing in Michigan?
Yeah, so again, we've expanded. Again, initially we were a couple hundred per day. We made an initial goal of getting to 15,000 per day. We met that and surpassed it. Our recent numbers show about 27,000 over the past week, which is 5,000 more than the previous week. So again, we're at a good place. Unfortunately, again, as a country, I don't think we'll ever be able to have enough testing, and not just, again, it's when I say test, it's the swabs, it's the reagents that the lab actually uses to run the test. It's the transport media, so what you put the tube and the solution that you put the swab in afterwards. There are all these kind of supply chain and process things that have to be in place and well run in order for you to be able to test effectively. And so we've come a long way. We're focusing on testing our most vulnerable populations as well. But I think that we still have a ways to go when it comes to being able to test appropriately in the state. I'd also add that we have over 300 testing sites across the state where people can go and get a test. We continue to expand those and work with partners. I know many people have probably heard about the long waits for test results, particularly with some of the national labs. That's why we have been able to diversify here in Michigan. So we have several hospital labs, in-state labs. We're building out our public health lab capacity as well to be able to address the testing needs across the state.
What is the turnaround time on average here in Michigan for a test result?
You know, it depends on the lab. For a lot of them, it's anywhere between 3 to 4 days. We'd like that to be down to 1 to 2. And again, it depends. If you're at a hospital, most of the hospital labs can turn around within 24 hours. Actually, they're testing their own patients often. But it depends, but certainly the commercial national labs, I won't name them here, but some of the commercial national labs have a longer turnaround, and we are aggressively addressing that as well. But I'll just say, we all know that 7 to 14 days for turnaround for a test is not sufficient for a public health response. If someone's going to identify if they have the disease or not, be able to effectively isolate and prevent the spread, we need that time to be as short as possible.
Yeah, no, certainly some places nationally, we're seeing just unacceptable turnaround times for that. So testing leads to contact tracing. Tell us, what is contact tracing, Dr. Khaldun, and why is it an important tool to fight this virus?
Mm-hmm. So case investigation and contact tracing are really nothing new. We use it with STDs and HIV, hepatitis A, which we had an outbreak that I led the response to in Detroit a few years ago. So it's nothing new. So what happens is someone gets a test, and then if that test result comes back as positive, we get alerted at our Michigan kind of technology system, MDSS it's called. And so once that happens, we send that information out to the local health department. And so then we have staff who do that first case investigation. So case investigation is actually where it starts. That's when you have that initial kind of index positive case. We call them, and sometimes it has to be a family member if that person is very ill. We call them, we get information about their symptoms, where they've traveled, and their close contacts. And so that's when the contact tracing piece of it starts. We identify all of those contacts. Hopefully, ideally, we have a good phone number for those individuals. Of course, if someone is not well known or is not unknown, period, to that index case, it can be difficult. But then we call all of those potential contacts, and then we let them know that they've been exposed. We let them know that they should quarantine. And then we actually do the incubation period. So that's this 14 days that you hear about. That's how long it takes you to develop the disease if you're going to, once you've been exposed. We contact them continually to make sure that they're not developing symptoms, see if they need any support. And that is how we kind of box in the disease, making sure that they're quarantining appropriately. So isolation is when someone actually has the disease and they have to stay away from others. You already know you're positive. Quarantine is when you've been exposed and you need to stay away from other people while we figure out if you're going to get the disease or not.
So, I'm going to ask you a question just out of personal curiosity here. I'm going to take a little bit of an off ramp here. The 14 days. Now, is that the average incubation time between the time of exposure to the time of symptoms, or is 14 days kind of like the maximum time? I've never really understood the 14-day, what the 14 days actually meant.
So it's an incubation period, and every infectious disease basically has one. There was one for hepatitis A as well, and measles and all that. So 14 days is the incubation period for the disease. So that is you can think of it as the maximum. So if you're going to get sick, if you're going to get the disease, it's going to be within that 14-day period. Most people actually will come down with symptoms much sooner. So usually it's about 5 to 6 days. But again, that's kind of an average. Some are within a couple of days. Some it's day 10, 11, 12, and sometimes 14. But 14 days is the maximum. If you are exposed, let's say someone coughs on you today, they have COVID, that's day 0. You go through 14 days, you stay home, you stay away from other people, and hopefully you don't get sick.
Gotcha. Okay, that kind of 5 to 6 day, that's really helpful. So back to contact tracing. So the model you described obviously is personal contact. So I'm tested positive for COVID. A contact tracer contacts me and goes through that history that you just described. Now, what about if one of my locales was, say, a local restaurant? Then how does it work with that local restaurant where I may have been on say a Tuesday, and the people who I may have been in contact with at that local restaurant?
So that's an excellent question. And what you're describing right now are the limitations of contact tracing. So again, different disease, but you may recall with hepatitis A, you tended to see some press releases come out sometimes. And we would say a restaurant worker had hepatitis A. If you've been to this restaurant, you may want to think about symptoms and getting tested. Again, that's a different disease. I don't want to confuse everyone. But yes, sometimes we don't know who you've been in contact with. So that's why the relationship actually with businesses is so important. Businesses, sometimes they keep track of people who have come into their establishment. They know, and I know many businesses we're working with they have their own internal kind of contact tracing programs, and they work very closely with the local health department if necessary. In the situation of a restaurant, sometimes people don't know. We would obviously talk to that index case, and their employer would be notified, and we do contact tracing with definitely the co-workers in that establishment. But sometimes you may not be able to identify who those specific patrons were that server, for example, may have been in contact with. That also is why it's so important, these basic things: wearing masks, social distancing. If you're a restaurant worker, but you had your mask on the entire time, and you stayed 6 feet away and you were only outside, even if you come down with it, it's much less likely that you'll actually transmit it to other people, because contact tracing, while it's incredibly important, it is not 100% perfect, and we sometimes miss people who may have potentially been exposed.
And I just read recently that wearing a mask, even if you do contract COVID, it could lessen the severity of the impact on you if you take those precautions. So you still might get it, but even if you get it, it might be lessened. Is that did I read that correctly?
Well, it's difficult to say. So the severity of disease, and again, we're still learning about this virus, of course. But I can tell you, and I've had colleagues who have passed away, unfortunately, who work in the medical field. But those colleagues, ICU doctors, ER clinicians, nurses, physicians, the thought is that they might have gotten more sick because they had a higher viral load that they were exposed to. So that's probably what you're thinking about. If you're treating, ICU patients, high viral loads, you're treating multiple of them, you're going to get exposed a lot, and probably to a lot of virus. But yes, if you've got a mask on, hopefully less of the virus, you're getting exposed to less of the virus. But there's still potential with the mask on for some of the particles to get through, which is again why it's so important to do not just the mask, but the social distancing as well.
Yeah. But at the that message, just wear a mask. Period, is just such an important message. Again, back to contact tracing. Yesterday at the press conference that I had the privilege of joining you at, you noted that not all of the outreaches by the contact tracers have resulted in success, either incorrect contact information or people not responding. That obviously is a significant issue. What are the steps that the state and public health authorities across the state can take to make that more effective? And what should people be looking for? Like when they get a call, should they be looking for a particular area code or a particular name on their caller ID? How do we encourage people to pick up the phone?
Right, you're right. So again, there's a little difference between the case investigation, so that initial positive case, and then the context of that person. But we're reaching out to at least 90% of individuals who have tested positive within 48 hours. And again, roughly 2/3 of them are answering the phone. We're reaching out to all of their contacts. For our state public health workers, all of the contacts are being reached out to. But we have, again, a much lower level of people answering the phone, people who may have been exposed. So we're working on several things. One, where we are building that contact tracing army, if you will. We've got right now about 1,000 people between local health departments, volunteers, and state health department staff who are working on this day in and day out. We also have an additional about 10,000 people who have actually volunteered to be able to do this work as well, and we pull on that pool. We've put out $10 million over the past couple of weeks to the local health departments to improve our staffing levels there as well. But to your point about what can people look out for and how can we improve like the pickup rate, if you will, we're expanding we're using technology. So one, we just implemented a text messaging platform where, and again, I get it, people may not answer their phone the first time. I often don't answer the phone when there's a random number that I don't know, but people often look at that text message. So we're now going to be using a text message so that when you'll know that someone's going to be calling you. We still need that personal touch and to speak to you, but hopefully someone will know that it's real and they'll pick up the phone. We're also going to be working to develop a two-way text messaging platform so that people can also interact with us. And then for the contact tracing piece, again, that's where for the duration of that 14 days, we're checking in on you. We're seeing if you've developed symptoms, helping you get a test if you need to get a test. We're actually, if you are contacted, you can actually opt in to a text messaging platform so we can communicate with you in that way, as opposed to the live telephone call every day.
That's great. Before I turn it over to my colleague Matt, let me ask you about the My Symptoms app. Can you describe what the My Symptoms app is and why people and businesses should encourage their employees to download it?
So again, it's so important that we identify disease as quickly as possible. So anyone who may have symptoms, making sure we identify them, that they appropriately isolate and get tested. So we, in partnership with the University of Michigan, who's really been the School of Information, School of Engineering, School of Public Health, School of Medicine, have been great partners throughout this COVID response. We've partnered with them on this My Symptom app. So it's a web-based portal. You can go to our michigan.gov/coronavirus website to get information on how to sign up. But working with employers across the state, they can log onto this portal. You can put your symptoms in every day, really, before you go to work. And if your symptoms flag, basically the local health department will be notified. We'll work with you to get tested, ask you some more questions, and that's how we'll be able to determine or make sure that people who could potentially spread the disease are not. And it's been a great partnership with our businesses as well.
Okay, great. Matt, I think we have some questions from our audience.
Sure. Thanks, Andy. Thanks, Dr. Khaldun. I know the information you share every bit, in the long run, saves lives and helps all of us live a little bit healthier. So thanks for being with us. Some questions here on the split screen. Folks are wondering, you talked a little bit about some different types of contact tracing, but people are curious, why did the state choose our current contact tracing program? Is it evolving? I think we've heard a little bit about the text messaging program, and other plans to look forward, to what could be contact tracing 2.0, or I guess maybe 3.0 in the tougher months ahead.
So I'll say, contact tracing, it's really an evolving thing. I wouldn't say that it's, again, anything that's new. Local health departments and state health department, we've had contact tracers on staff. Again, you got a disease, we're going to find out who your contacts are and call you. So we've been doing that for some time. Obviously, we've had to develop rapidly and grow with the COVID-19 response. And so, again, we've built up staff in the very beginning. We actually, again, reached out for volunteers. We actually had state health department staff, about 100 of them, who actually normally work on the STD and HIV contact tracing, but we pulled them over to especially support Southeast Michigan when it comes to contact tracing, supporting those local health departments. And so we've actually also built out our technology. So I talked a little bit about the texting technology, but we internally actually have a system as well that there's no question, you can ask anybody, it's outdated, and it wasn't really helpful for contact tracers. So we had to actually build out a new contact tracing kind of management platform internally. We started with the state. We now have many local health departments who are using it as well. So building out that technology so that the contact tracing work can be as efficient and successful as possible. We'll continue to evolve. We continue to learn more. Again, we're building out text messaging two-way platforms as well. And so we continue to grow and evolve as we fight COVID-19.
Sure. So, I mean, folks are asking, and I've noticed too, I mean, there's an option. I mean, I use an iPhone. I think folks can do it on Android too. There's options, and I think maybe active in different states where you can opt in to use the random ID Bluetooth technology or something like that. That's something we don't use. Is that something that is being looked at?
Yeah, again, we've looked at a lot of technology platforms, but I'll tell you, we've even spoken to, Google, Apple, and even they don't believe that it's something that should replace the good old-fashioned contact tracing that's been in public health for a while. We're actually looking at some potential partnerships right now. I don't want to speak too soon, but we're looking at some partnerships in particular populations where some of that technology might be useful. But it's also important to know that there are limitations. If you can imagine, you're in a room right now, there may be someone who's on the other side of a wall who you'll never come in contact with. They're in another office. Maybe they get it, but your phone may tell you that you were exposed when in fact you probably weren't because you never even came in close contact with that person. There's a wall. So we still need that kind of personal aspect. It wouldn't replace the good old-fashioned contact tracing, but it's something that could augment the response for a particular population.
Has the potential maybe for some false alarms, it sounds like.
Potentially.
Yeah. Most of the folks on the line right now, I mean, obviously Detroit Chamber, we're members are businesses, and folks are operate not only in this health crisis, but this economic crisis as well, which is happening at the same time. And given some of the numbers that we've talked about with the number of cases that sometimes aren't caught in the contact tracing, what opportunities or what things can businesses be doing to enhance the contact tracing that the state's doing on their end? I know sometimes you go into a business and they have you fill out a form, questionnaire, things like that. What things can businesses do proactively to supplement the state's contact tracing efforts?
And I would just say first and foremost, I'm just grateful to all the business owners out there who have sacrificed so much. I know people are struggling economically, but I also know that folks are putting health and safety of not just their workers, but the people who are patronizing their businesses first. And so I just really appreciate that and recognize that it's been an incredibly challenging year. I'd also say that before we even get to the contact tracing, the most important thing that businesses can do is, again, making sure their people who are coming to their establishments are wearing the mask, making sure they're following all the public health guidance that has been put out. That's the most important thing that you can do. Cleaning, masks, social distancing, the barriers between workers or people, if it's in an indoor restaurant, making sure those barriers are in place. So those things are just incredibly important. For the contact tracing, I think it's really important that businesses, and I know many have been doing this now, you should know your local health department and reach out to your local health officer. They are on the ground, step by step with us at the Michigan Department of Health and Human Services. They're there to support local businesses. If you need help with your plan that you currently have in place, you have some questions, you can actually reach out to them as well. And while we haven't mandated it necessarily, if you're keeping good track of people who are coming into your establishment, especially if there's like face-to-face contact, between your workers and people from the public, it's a good idea to think about how you'd be able to get in touch with those individuals if there was a potential exposure.
Thank you. That's, I mean, certainly helpful information. I think businesses want to be part of the solution. Some folks are asking too, you know, manufacturing has been open, you know, for the most part through the beginning of this, and wondering if contact tracing has been able to identify, you know, which of those best practices that have been implemented, strict ones, have worked in businesses or businesses that, you know, it might not have worked.
Mm-hmm. So again, I think that what we've identified is that when people are gathering in large groups, when they're not wearing masks, that's when we've seen spread of the disease. And unfortunately, we've had to roll back some of the reopening in the state. We've also seen some spread between employees. And again, I don't always know, you know, business by business why there was spread, but we've seen spread between employees of particular establishments. But when they're washing their hands and when they're wearing a mask, the spread is much less likely to occur. And it's very simple. When we are looking at places where there's outbreaks and people have been in close quarters with each other and not doing those basic public health things, that is when we're seeing spread of the disease.
Great, thanks. Sandy, that's the bulk of what I have on my end. I know you might have some follow-ups too.
Yes, well, thank you, Matt. Great job. I know we had more questions in the chat than we'll probably have time to get to. Dr. Khaldun, we're getting ready to wrap up here. One of the things with this virus, obviously there's many things with this virus that cause challenges, is the incubation time that we talked about, and thank you for educating me on that. But also the presence of asymptomatic people. So can you link for our audience various decisions that have been made, such as, you know, imposing the stay-at-home order, lifting the stay-at-home order, strengthening the mask requirement, to our outcomes 14 days later?
Right, so you're right. It is absolutely true, like, as we keep learning more and more about this virus, that people who don't have symptoms can still spread the disease. And so when we initially relaxed, the governor initially relaxed the stay home, stay safe order in the beginning of June, we, again, within a couple of weeks, which is the incubation period, started seeing increases in cases. And we look at the breakdown of where all those outbreaks are occurring. So sometimes it's certain businesses, sometimes it's restaurants. There's a lot associated with social gatherings as well, whether it's at a large place or at kind of family-centered gatherings. And so we look at all of those things when it comes to kind of how the disease is progressing. I can tell you, since we saw that slight uptick in cases after the initial stay home, stay safe order was lifted, over the past couple of weeks, we're actually seeing a slowing and a plateau in cases. Again, unfortunately, the governor had to go back and close indoor bars. We did strengthen, it wasn't new, but we did strengthen our mask executive order as well. And I think people also are just kind of paying more attention and saying, oh, this is real. And so again, it's Michiganders doing their part. But when we do these basic public health things, the numbers come down. There's just no question about it. So if people just keep doing that, we'll be able to keep the numbers down. And importantly, like everyone wants, keep businesses open, maybe even open additional businesses, and have our kids go back to in-person learning. Go back in September, late August, but also stay. But again, it all depends on how we all behave and doing the right thing.
Yeah, I really appreciate that last point. When the governor strengthened the mask order, we actually at the Detroit Regional Chamber applauded that, and that wasn't a universal view in business, but our view was that the governor very much made the right decision, because if people aren't wearing masks, we're not going to be able to keep our businesses open. And as you know, the chief advocate for business for Michigan's largest region, our primary responsibility is do what we can to keep businesses open, and we're open for that deal, but people have to wear their masks in order to make that happen.
That's right. That's right. I appreciate your leadership there.
Yeah, so yeah, no, so I encourage everyone who's listening in, the business owners and the employees to take up the Chamber's Mask Up Michigan Challenge, and it's on our website. We really encourage you to do that. Just encourage people to wear masks. Well, Dr. Khaldun, we've come to the end of our time, actually just a couple minutes over, but want to just throw the floor over to you. Is there any other final comments that you'd like to ensure that our audience today leaves this conversation with?
Well, thank you for having me on. It's really been a pleasure. And again, just reiterating how grateful I am to the business community for all that you've done, continue to do, and all that you've sacrificed and are still sacrificing. So I absolutely appreciate it. We're not out of the woods, and unfortunately, it's going to be at least another year where we're kind of in this stance where there's not a broadly available vaccine for everyone, where we're still trying to keep these cases down. And so we're all going to have to be patient. We're all going to have to keep on wearing masks, social distancing, and just being smart about interacting with each other. I'm confident we can beat this disease. We can do it. We've got tools, and we'll be getting more tools, whether it's an antiviral or a vaccine. But it's important we all just stay the course and support each other. So thank you for having me on today.
Well, Michiganders are hard workers, and Americans are an innovative lot. We will solve this problem, but you're right. We're going to have a road to go. Dr. Khaldun, on behalf of the Detroit Regional Chamber and Matt Patton and myself, thank you so much for joining us. State that has taken their valuable time to join us today. Thank you for your time.